Welcome to another episode of Botox and Burpees. I am here with my very special guest, Marissa Liza.
Thank you.
She is a licensed acupuncturist, and she is also someone who has been taking the peptide BPC 157, which is one of the hottest compounds out there in terms of recovery and wellness. And so we're going to take a little bit of a dive into BPC 157. We're going to talk about the scientific research, the background behind it, and Marissa's experience with it, why she takes it, and what we can take away from her experiences with it. Let's first talk about Marissa. Welcome thank you for
Thank you,
guesting.
Sam.
And I
Thanks for
really,
having me.
really appreciate you sharing your experience. It's so funny because she was at the gym the other day and she talked to me and she said, "Hey, I listened to your creatine one and you really should do one on BPC." And I was like, "Yeah, I really should. I was thinking about it. And I know a lot of people that are on it or are taking it." And so at that point I was like, well, and then about a couple days later, you were like, "I'm taking it." And I was like, "Wow, that's crazy." I don't know anyone who I would actually trust in terms of their opinion, in terms of their anecdotal experience. And then I said, "Okay, we definitely have to do this."
Thank you.
Just to let you know, Marissa Liza is a licensed acupuncturist. Her Instagram handle is allpointsacu. Her website is allpointsawc.com. Her office is in Rochelle Park. She's treated so many people at the gym. I just had a couple people say to me that they just saw you. They loved your care.
Thank you.
And
Thank
and
you.
I've had treatment by Marissa, and she's awesome. Shout out to your business, your expertise, and you're someone that I would really trust in terms of talking about BPC 157.
Thank you. Thank you for having me and the kind words. Yeah, I'm just excited to sort of explore this from all angles with you.
So why are people caring about BPC 157? All right, they say it's awesome for healing injuries, reducing inflammation, aiding recovery. And before I begin, just as a reminder, this is not a substitute for professional medical advice, diagnosis, or treatment. It's for informational purposes only. Treatment and results may vary based on circumstances, situation, and medical judgment. Always seek the advice of your qualified healthcare provider with any questions you may have, and never disregard professional medical advice or delay seeking advice because of something in this show. So BPC 157 stands for Body Protection Compound, BPC 157. It's a sequence of 15 amino acids, so technically a pentadecapeptide, and they found it in the stomach, and scientists isolated it from a gastric protein, and they synthesized it. So it's actually a lab-made peptide, but it's based on a natural stomach protein that they found that appeared to protect and heal tissues. And this was something that initially was what piqued your interest, right?
Yes. So I had heard about it probably about 2 or 3 months ago. Another provider had said, "Hey, I'm taking this," and I kind of honestly didn't really think much about it. I was like, "Great, sounds good." And then I had went to a seminar. I needed some CEUs, and there was another provider there, and he was just talking amongst us. It was about 8 of us, and we were talking about different healing modalities and different issues. And he says, "I'm having really great results with BPC 157. So he's also licensed in Florida. And in Florida, it is legal for acupuncturists to do injection therapy. It's within the scope of their practice. So
Okay.
not here in New Jersey.
Mm-hmm.
So he said, "I have been injecting it, and some of my patients are having really great results with tissue repair post-surgical." So I was like, wow, okay. So there's a part of me like, okay, this is somebody else saying it to me. I definitely heard the anti-inflammatory healing athlete side of me, like, let's go. I want to be able to continue to perform, athletically well. So that was sort of let me try this.
Right. And you are and I've known you for years, and you are a very high performing athlete. You've done how many high rocks competitions?
2 high rocks.
Two, and multiple CrossFit competitions. Like, you perform at a very high level.
Thanks.
And obviously fitness is very important for you.
It is, and I sort of feel like probably in the past, like, 2 or 3 years, I feel like the years of training, have sort of caught up to me a little bit. I felt, like, a little more achy than I usually feel, maybe something's going on, I'm not recovering as much as fast as I used to. So that was also a factor.
Yeah. And so these biologic mechanisms by which BPC 157 is thought to work is very intriguing. It's thought to help with tissue repair and regeneration, muscle, tendon, and bone, helps to activate growth pathways, increase growth factor activity, anti-inflammatory effects, reduce excess inflammation and swelling, angiogenesis, where it stimulates new blood vessel formation, more oxygen and nutrients to damaged tissue. It's also hypothesized to increase nitric oxide, which is a blood vessel dilator, improving microcirculation.
So all the words that we want to hear,
Yeah.
the things that are like,
Right.
oh, I need this.
Yeah. So if you are an athlete or someone who feels like their recovery is not as good, or their training protocols are really leaving them sort of beat down, then something like this seems like it would improve those metrics.
Sure. And it's also, I think, our human nature to be like, oh, I want the next best thing that's going to help me. What's going to keep me in the game longer?
Right.
Right.
Now, and we'll get into the research a little bit more, but right now, just it's mostly been in animal and lab studies. And that's always like, I've done a lot of animal and lab studies in my past. And so I'm always a little skeptical when it comes to that. I think human clinical experience is probably the gold standard in terms of knowing what actually happens. But clearly, the research that has been done so far has been very promising.
Yes, there's been a lot of research done, again, only on animals. But I also wonder, why haven't they tested it further on humans? Right? What's preventing that?
Right. Probably, in my guess, and this is just a total guess on my part, is money. So if this is not a patentable, like if it's not something you could put on patent, probably there are not going to be a lot of pharma guys who are going to really want to invest in it, because you can't protect it, you can't make it your own, you can't sell it in exclusivity, and so a lot of possible drugs are not worth the investment to take it through FDA approval because of that. That being said, I wouldn't be surprised if pharma, if they found that there was some benefit to this, they'll probably tweak it, add a couple amino acids here and there, find another proprietary version of this, and then sell that as the next great recovery drug. I don't know. We'll see.
And then, of course, again, I'm playing devil's advocate here, right? You also, and again, this is just stuff that I've read, and I get it. There's the other side of it. Well, it's like, this is so wonderful, so they're never going to let it come to the market because it's going to be, it's going to keep people from getting surgeries, and then big pharma is not going to make money, and all that. There's that other side of it too. I don't agree with that,
right?
But I'm just,
yes,
that's the other thing that you hear.
I mean, there are certain drugs that are game changers in terms of the industry. I would say the GLP-1 agonists, the Ozempics are, probably has impacted surgeons as well as primary care providers in a huge way. So I think if someone can make money off of it, that's where the direction of it is going to go.
Okay.
One of the things that was very interesting is the faster healing of injuries suggestion, where accelerated tendon and ligament repair. Have you had any major injuries for which you were sort of investigating this use for?
I did not have a major injury. I would say I've been dealing with a right shoulder pain, which felt a little more deeper than a muscular pain. I would get a lot of burning. If I overdid it, I could feel it it was a deep ache and more of a burning sensation that I had never had in the past. And I also would feel that I was a runner for many years. So probably in the past 2 or 3 years, my knees have been really bothering me.
Okay.
So that was sort of where I was like, oh, let me see if this
helps.
This helps with that. Right.
The other thing which what you mentioned was the first sort of thing that piqued your interest is the gut protection. There's a lot of evidence that BPC 157 protects the stomach and gut. It heals stomach ulcers in animal tests. And I think probably the first clinical indications are going to be for patients with chronic conditions, if it pans out, for like irritable bowel syndrome, Crohn's.
And that was sort of the non-athlete, the total healthcare provider part of me that was really interested in this, because I believe that the health of the digestive system is a major role in our overall health, especially when it comes to recovery of muscles and bones and just immune system. So that, and there are a lot of that I've seen clinically that have not even irritable bowel, Crohn's, colitis, and they're suffering. So if we can heal the gut naturally, that's can potentially help the rest of their health.
Yeah.
So that was,
that will be probably the next great frontier, is the gut, because of its microbial flora environment, which is a huge thing, which we're starting to sort of uncover in terms of absorption and metabolism and health. It also is sort of a second nervous system within the body. So all of these things, which we don't really know about how to manage in the gut, is probably going to explode, my guess, in the next several decades, because that's where I think a lot of people's health is sort of predicated on.
Yes, and I don't think it's gonna take the next couple years, or I hope not, because I think it's so important now, and I think it's something that's even overlooked, when it comes to what we're dealing with systemically, is that's the first place we should look, and sometimes it ends up being the last place that we look, so but I do think it's becoming more prominent. We need to heal that first before we can look at other things.
Agreed. So again, the real world evidence is not great. There's no major human clinical trials. We don't even know how it's really absorbed in the body. So as you said, it's like a lot of people use it as injections, but it is stable
Yes.
as a gastric protein in the stomach. So you can take it as a pill, but we don't actually know what the absorption rate is. What the drug levels are in tissues based on that. Like, it's all extrapolated off of rats,
Mhm.
which, I mean, there are a million things that work great in rats and don't work great in humans. So we'll have to wait and see.
And I'm not sure rats are really doing like, Murph.
Right. Exactly. We're not putting them through
We're
this.
not putting that level of strain and stress, they're not living in, northern New Jersey, right? So it's like
Yes, with the same type of aches and pains, as well as daily stressors on their mind.
sure.
They're a lot probably a lot simpler with that. But right now it's exploded. So I've heard of so many people using peptides. They call peptides. That's what they call it, peptides. And this is one of them. There's another one which we're not going to talk about today, but this is certainly probably the peptide when people are talking about peptides. Athletes, trainers, are using this. Anyone who has some sort of strain, tendonitis, muscle sprain, they're sort of turning to this. I do know a lot of chiro guys are just like handing this stuff out like
Mhm.
it's
Yep.
aspirin.
Anybody that's got an injury,
Yeah,
it's going
ibuprofen.
out.
It's going right out to
Going out.
them.
Yep.
So, okay. So, did you do a deep dive into the research after hearing about it, talking about it, before you decided to take it?
Not too much of a deep dive. I probably watched a few YouTube videos. I researched sort of what would be contraindicated to take it, which again, there's not much out there. So we're also going off of, okay, well, what's the worst it can do, sort of,
Right.
right? I mean, I know obviously my own health history,
Right.
so I felt comfortable taking it.
Okay.
Yeah.
So when how are you taking it? Is it an injection or a pill form?
No, I'm taking it in pill form.
Okay.
So I'm taking 1 pill a day.
Okay.
And it's actually been about a month since I started taking it.
Okay.
I did not do anything else extra in terms of recovery that I normally would do.
Okay.
All right. And I felt like I was training at the same level that I had been training at.
Okay.
If anything, I probably, aside from doing my regular gym exercise, I play like pickleball 2 or 3 times a week.
Mhm.
Sometimes can be a little intense. I'm on my feet 2 or 3 hours, or
Sure.
kind of, doing a lot of shoulder motion.
Right.
When I'm kicking butt, which is not very often because I'm not very good. But
Mhm.
neither here nor there.
So you take it once a day, you said?
Once a day.
And what is the dose that you're taking?
So I'm taking 250 milligrams.
250 milligrams.
Mhm.
And so after a month, what are your observations right now?
I would say on a whole, I do feel better. I would say that I still feel the same level of muscle soreness that I would feel if I had done a hard workout. But some of that burning pain has gone down in my shoulder, and I definitely don't feel sort of that deep ache that I used to feel since I started taking that.
And you can attribute that to the BPC 157 because not much else has changed in your
Not
life.
much else has changed. Nope.
Okay. Any side effects that you've noticed from it?
I haven't noticed any side effects. I did for a week take it without food to see if it would impact my stomach at all, and I did not notice any change whether it was with food or without food. And I would always take it generally around the same time, which is in the morning.
How did you source it? Like, where did you get your BPC 157 from?
I got it from a provider who I trust, who's been selling it and told me he trusted this brand. So it is, just as a side, it is available. There's a site out there that sells a lot of supplements called Full Script,
Mm-hmm.
which a lot of providers use because you can just send information to patients about stuff. So it is available on there, just as a side note. But I got it from another provider.
Have you recommended BPC 157 to patients?
No. I have
Okay.
not recommended it to anyone.
And now that you've taken it for a month, would you say it works fine as it is, or should it be integrated with other types of therapies or wellness treatments?
I think, when we're talking about, are you talking about for myself or what I recommended to a
Both.
patient? So I would, now I'm going to stop taking it for the next month and see if any of those other aches and pains that I had came back. At this point, I would not recommend it to any of my patients, primarily because I don't think that there's enough research out there to say, oh, this is a safe thing for you to take. And I also think that when in terms of healthcare, I tend to look at the basics first, right? Like, is the patient doing everything they can in their power to help recovery? Um, and if I can help them, obviously with acupuncture, because that's what I do, but also say, okay, are we getting enough sleep? How is our nutrition? Are we overtraining ourselves rather than saying, here, you're working yourself to the bone, but you know what? Try this and see if that helps. So that is typically how I treat. So I wouldn't recommend it.
Yeah, because none of us are doing any of those things. If you actually asked any of us, like enough, like I would say. Did you track yourself in any way? Did you do any sort of testing pre, post?
I did not. No.
Okay. Uh,
I really honestly went off of how am I feeling in the gym? How am I feeling after 2 days of training hard?
Hmm.
And then how does my body feel?
Okay.
Yeah.
So a lot of people do cycle for like 6 weeks and then come off of that. So how long are you going to stay off, and then when might you cycle back on?
I would take another 6 weeks, take 6 weeks off and then cycle back on.
Is it expensive?
Um that's a
I
term,
mean,
right?
so cost wise.
So I know that most people probably mark it up about 100 to 150%. So I purchased it at cost because I had a colleague that gave it to me at his cost.
Okay.
So it was for a 2-month supply, it was $75.
Wow, that's pretty. Even at 100% markup, that's still pretty cheap for a supplement.
Correct. That was at base. So the normal, not normal, somebody else would probably pay anywhere about 120 to 125. So
Okay.
he charged me his cost, which was 75.
Okay. So other than the providers you've talked to, do you know of anyone else who's been on peptides?
I consulted with a colleague of mine in Florida. She had tried it and she did not have much great result from it. She got it injected.
Oh,
Yep, because she had somebody that can do it for her down there, and she did it for 4 weeks and felt like I didn't feel any difference. And she was post-surgical knee pain.
oh, so she had it injected directly into the knee area?
Mhm.
Interesting.
Yep,
Okay.
and she didn't notice any difference.
Okay.
So
Well, let's talk a little bit about the safety profile of BPC 157. So, right now, it seems like in the short term, there are no major issues. Uh, when it's injected, maybe just a little bit of site pain
Mhm.
or irritation. In animal studies, they injected it ginormous doses and it didn't have any severe toxic or lethal effects, no major organ damage, no behavior change. So, it sounds like the safety margin is probably pretty good for this. Um, People who have taken it haven't, said that they've had high blood pressure or blood sugar changes or anything like that. I mean, again, in anecdotal
yep,
testing, and a lot of people like you are taking it and not necessarily like checking their blood sugars or their blood pressures or anything like that, but they're generally feeling pretty healthy.
definitely better.
Yeah. I would say if you wanted to play devil's advocate, the big thing is long-term safety, right?
Sure,
So anything that upregulates growth, cell growth, blood vessel proliferation is unwanted cell growth.
sure. So we have to look at this as, what if somebody has a history of cancer,
Right.
right? So, and do we know that as, of course, all practitioners, we do intakes and look at health history, but when there's not enough research and you're having, I don't think it's right, right? It's not anything you wouldn't want to take that risk.
Right. So that's always a concern. And you really, and I've looked at so many drugs that have even gone on the market and been taken off the market. And a lot of stuff you can't really see as an effect until you test it on a wide range of people in a wide range of situations
Sure. And a long period of time,
and a longer
right?
period of time. Yeah, I've gotten burned by so many drugs that I thought were awesome, and then they were taken off because of some issue.
Yep.
Liver damage in certain types of people, or this, that, or the other thing. So I wouldn't recommend anyone just sort of jump in, and I think you're right as a clinician. Like, it's one thing. Listen, we've all experimented on ourselves. We're probably some of the big. Like, I think clinicians are sometimes the biggest experimenters,
Yes.
but we probably wouldn't, or we never should, or ought to experiment on the people that we're taking care of. And so that would be one reason why providers ought not to really sort of throw this at people without actually knowing more
More
about
about them.
this.
Yeah. And I think now too, like patients in general, they're becoming more complex, right? We're dealing with more complex conditions. They're taking a lot of different medications.
Right.
So we don't exactly know how is this going to interact
That is correct.
with the medication.
That is correct.
So
Even and the other biggest issue with any drug or any kind of substance is immune reaction. So it is a peptide. You can develop an allergic reaction to it, produce antibodies. I've seen that even with rarely with Botox,
Yep.
even, which is, or some people have, listen, if you can have a reaction to Tylenol or Advil or any of the most common over-the-counter drugs, there's no reason why you couldn't develop one to something like this.
exactly.
And the other thing is it's not regulated. So purity and quality will always be an issue. I mean, you can source it from a very trusted source, but even then, there's no outside regulation to trust what that company is doing. You're basically taking them at their word.
Hmm.
And
I mean, I don't know that's true for a lot of different things out there that they're not regulated so much, but it's not a risk that I'd want to put anyone to.
correct.
Yeah.
So let's talk about the regulatory status right now. So right now, it is not approved by the FDA for any human use. It's not an official medication. It's not a dietary supplement. You can't sell it as a supplement, actually. The way that it has been sort of sold is through a legal gray area. It's called a research chemical. So that means companies can sell it for, quote, lab use only. People who buy it are technically using it at their own risk. It's not an illegal substance, but if you're giving it to someone with the specific use that they're going to be using it, that's actually illegal. So, I mean, it's a gray area, and
Yeah, sure.
I'm not gonna go around, And interestingly, in New Zealand right now, it's an investigational prescription only medication. So it really depends. Like, there is a lot that's out there that we're still sort of figuring out with this drug.
Sure.
And the FDA is always the slowest, of course, but sometimes being slow isn't
It's not
necessarily
bad.
bad. Yeah. The biggest and most important thing is it's banned in competitive sports right now.
Yes.
So the World Anti-Doping Agency classifies it as a non-approved substance. So even though it's not a steroid or hormone, if you are on it and you are competing professionally or at a high level, you're going to light up positive
Yes.
for this. For the average person, it is legal to purchase and use. You just can't market it. You can't tell people, hey, take this. So it's sort of weird. I don't know how medical providers are sort of
Getting around that.
well, right. So is it one of those things? And I can imagine patients saying, hey, do you have peptides? And then saying, don't ask me about it, but there are these research chemicals which are available. I don't know. It's all very
It's very gray.
legally,
Yeah.
weird. So, so I don't know. It's really a biohacker type of situation right now.
Sure. And I mean, this is, as we know, this is just one of the many biohackers, or it's a buzzword that
Right.
everybody that's putting out there, right?
Right.
How can we stay stronger? How can we stay fitter? How can we live longer? How can we perform better?
Right.
So it's just another one in that line of products that are out there.
Right. And
So
I mean, I have seen people advertising peptides online when I started looking into this,
sure.
and they're probably skirting that line a little bit. But I don't think the FDA is going to go around stamping out every individual practitioner
No,
who's
I
doing
think
that.
there's definitely bigger fish to fry when it comes to who are we going to go for.
Right.
And yes, I did the same. There's a lot of places out there. I actually, of course, I went to Florida because that's where I heard about it. But
Right.
there's lots of facilities out there. And my colleague had said that peptides and injections are huge down there.
Mm.
Like everyone's doing them.
Mm-hmm.
Most of them are regulated, or they're not regulated. They have an MD on staff.
Mm-hmm.
So I think that is also maybe how they kind of get around it or feel like it's safer at some of these places,
Mm-hmm.
rather than just an acupuncturist doing it.
Florida is such a wild west for medical care. I'm serious, because as a plastic surgeon, all the craziest stuff you hear about aesthetic surgery happens down in Florida. They are the most heavily regulated in terms of liposuction, fat transfer, tummy tucks, because there have been so many complications down in Florida because there's no med mal coverage. Everyone goes bare. You can't even, because you can't afford medical malpractice coverage
In
in
the state.
Florida. So every provider has has a patient sign a consent saying, you are aware that there's no insurance. I don't have any medical malpractice insurance coverage. If there's anything that adverse happens, like, blah, 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 blah. So like, it's crazy in Florida. Like, there's just a ton of fly by night stuff that goes on there. That being said, I don't want to cast a shadow on BPC 157. Like,
No.
it could be in 5 years. This could be sort of the first line treatment for someone who has gastric issues, or who needs a little, bump when it comes to their knee replacement or ACL replacement.
So that was what, when I thought about if I were to give this to a patient, or who I thought potentially could benefit from this based on how I feel after taking it, I would say a post-surgical patient would be somebody that I would recommend it to, right? So, because you've had the trauma of a surgery, so that tissue is trying to repair. So if this can be of assistance to that, then that would be great. Rather than, again, like somebody who's not doing the basics, overtraining, overworking, looking for something to just like magically help them without doing the basics. So that's sort of my take on that.
Yeah, I think that's a good takeaway. I mean, in terms of someone who might be taking it, I think personally, I'll be checking in on you and seeing how you're. Yeah, I.
There is a part of me that says, okay, let's take off the 6 weeks, right? Do regular training,
Yeah.
right? See if I feel any of those
Right.
aches and pains.
Yeah.
And again, I also think like there's so many other factors that influence how we feel,
So
right?
true.
There's the hormone factor.
Yes.
There's the female for just being a female, right?
Sure.
So there's, this is just me coming. So, oh, I know the way I feel, right?
Right.
But I can't. When you come to a patient, right? When you're not testing, you're not actually doing something to say, okay, let's have a study here. Let's check how you are.
Yeah.
Again, that's why this is in the gray area.
Mm.
But there's, like I said, there's part of me that wants to then, after 6 weeks, go back and train like more than I had been and see if it makes a difference. But I'm not going to do that. I don't want to.
That's so interesting. I am a little bit of a scaredy cat when it comes to trying out stuff like this.
Okay.
I did a podcast episode about rapamycin, which is longevity medication, and I still haven't taken it yet. I have it, and I haven't taken it yet. I'm still a little chicken crap about it, like, because and so, because I'm not in a really terrible place right now. I think there's certainly a place I could see myself in a certain place in life, acute injury, chronic pain, some sort of really bad gastric disturbance where I'm just fighting something and it's just beating me down. No, I would certainly, looking at this evidence, I would say I'll take a cycle of BPC 157 and see what it does for me. But I would have to sort of be in dire straits at that point.
Gotcha.
I am not, obviously, if anyone is competing on any level, they should not be taking this. If you pop for BPC 157, that's probably the stupidest thing you could do. Like, there are probably about 50 other PEDs out there that would help you more. Like, prove
you're going to do it. Take
right.
good
Yeah.
stuff.
Take something really that's going to help. If you're going to run the risk of popping. But for me, where I am, the other thing is that it's really for longevity for me. So I work out for fitnessing. You work out because you really enjoy it.
Yes.
Oh my God. Anyone who I've seen, everyone who does high rocks, the people who really grind and push, like, there is and I understand it, is such a huge joy and boost in quality of life to be able to do that. And so that is why I see a lot of people at my gym getting the knee replacements, the shoulder surgeries, the things that they don't necessarily need to have on a daily basis in terms of functioning. But in order for them to perform at the level at which they want to in the, in the gym, doing athletic activities,
Yes.
they have to do these things.
Yes.
And if you have issues which are preventing you from fully enjoying your life to the extent that you want to, if you couldn't participate in a high rocks event, if you couldn't throw down on a weekend or go to the gym and do the things that you want to do, that is a huge diminishment of your quality of life.
100%.
And if you're sitting there like, oh, my shoulder is just like, and it's not enough to like warrant something invasive, but it's not like really great, and it's not, it's smoking along but not doing awesome.
Hmm.
I could see that.
Sure. And I think that's, and as healthcare providers, right, when you have somebody, going back to what you're saying about them being in dire, right, like you want to help somebody the best that you can,
Mm-hmm.
right? So it's and this is where this, like you said, potentially could be great, because maybe it's going to get them through that next 6 or 7 weeks of post-surgical where they're like, hey, great, we're going to repair this, and then you're going to be able to get back to doing something that you love. It's always that fine line of wanting to take care of the patient, feeling like you're actually doing something for them, whether it's with whatever modality you're doing or recommending a supplement, that you're getting them on a better path. And again, that's very much an individualized thing, but also helping them understand their role in the process. So,
How about the other now? Just to sum, like there's another, when people talk about peptides, there's another one, TB500. Have you heard about that one?
that I've not heard about.
Oh, okay, because a lot of people will stack both BPC 157 and then this TB500.
I'm sorry, I've heard of the stack.
Y-
That I did not know that was
Yeah.
and
And we won't talk about it, but just very briefly, it's a synthetic peptide, which is, again, a fragment of a natural occurring protein, just like BPC 157, thymosin beta 4. That's why it's TB. And then it's supposed to mimic the active region of this protein. It's currently actually being studied for skin conditions because it has something to do with actin and sort of binding to the actin protein. But so a lot of people are stacking those. Again, we're not going to talk about that. There's always something on the horizon. But we've also seen stuff that supposedly help that hasn't panned out in the past. I actually should take a deep dive and look at all the things that people thought were gonna work. I
from
think
like a supplement perspective.
yeah, or drugs. Like I remember the biggest one. Well, this was when I was a kid back in the '80s, called Latril, which was a derived from peach pits, and it was supposed to be an anti-cancer drug, and it was sold in Mexico. And so a lot of people went down to Mexico to get this anti-cancer treatment because it wasn't approved in the United States, and it did nothing basically. So, and I can't tell you about how many drugs that I have prescribed, at least 3 or 4 that were initially awesome, like new antibiotics, taken off the market after they figured out, in widespread distribution, that it caused major problems. So I would say it's exciting.
Mm-hmm.
I really appreciate you sharing your experience with it. It's hopeful. I'm very glad that you've felt like there was some benefit from it.
Thanks.
I'm really interested to see what your second cycle's like.
Yes. Me too.
If I was wanting to bug you, I'd be like, I mean, it's a pain in the ass, but I would say get a bunch of metrics, like do a blood panel workup, see where your blood sugar is, what your blood pressure is during this, all that. But it's like,
I mean, I could take my blood pressure every day.
but that would just be that would be using you as a guinea pig,
Sure.
which is time consuming and annoying. So listen, if it works for you, if it works for anyone else, that's great. This is just sort of informational, so people can sort of take out of it what they will.
Yes.
If anyone out there is taking BPC 157 and you want to chime in and talk about your experience with it, that would be really helpful. We would enjoy that.
Be very curious to see how other people are doing on
Yeah,
it.
and
Because of course I always hear like, I'm doing great. I'm doing great. I somebody who's giving it to you is like, I've had great results. All my patients have had great results, which I understand.
absolutely. And if you need additional wellness and treatment, please go see Marissa Liza.
Thank you.
All Points ACU is her Instagram. allpointsawc.com is her website. She is an awesome licensed acupuncturist, great athlete. She also gets and sees that, she understands the mindset of that athlete who wants to push. So if you are one of those and you're in that situation where you're needing recovery, you're needing additional therapy and treatment, I know BPC 157 is one possible way of doing it, but acupuncture is definitely a tried, true
Yes.
performance enhancement in that
It is the
regard.
natural anti-inflammatory nervous system repair.
It is not illegal, and and that may also be helpful. So that's basically my way of saying explore all your other therapies, and if you are sort of, in my opinion, at that point where you're not, you might think about trying something like this.
Sure.
But thank
Make
you.
sure you're doing all the things that you should be
That's
doing first.
exactly
That is
right.
always my first,
So true.
always my first line.
So true. And I appreciate that, Marissa. Thank you so much for being
Thanks.
my guest.
Thank you.